Question number 1. Which hormone is primarily responsible for ovulation in female? Here, right option is option C, luteinizing hormone. Question number 2. Where does the implantation of fertilized ovum normally occur? Here, right option is option B, uterus. Question number 3. Which structure in the male reproductive system store and mature sperm? Here, right option is option C, epididymis. Question number 4. Which hormone prepared the uterus for pregnancy? Here, right option is option C, progesterone. Question number 5. Where does fertilization usually take place in the female reproductive system? Here, right option is option C, fallopian tube. Question number 6. Which gland secretes the hormone testosterone? Here, right option is option C, testes. Question number 7. Which method of contraception acts as a physical barrier to sperm? Here, right option is option B, condom. Question number 8. Which hormone is essential for the maintenance of pregnancy? Here, right option is option B, progesterone. Question number 10. Which organ produce both ovum and female hormones? Here, correct answer is option B, ovary. Question number 11. What is the main function of the scrotum? Here, correct answer is option C, regulate the temperature of testes. Question number 12. Which hormone mainly control the menstrual cycle? Here, correct option is option C, pituitary and ovarian hormone. Question number 13. Which hormone causes the ejection of milk during breastfeeding? Here, correct option is option C, oxytocin. Question number 14. What are the fallopian tube also known as? Here, correct option is option A, uterine tubes. Question number 15. Which organ is considered the primary reproductive organ in males? Here, correct option is option C, testes. Question number 16. What is the process of sperm production called? Here, correct option is option A, spermatogenesis. Question number 17. Which function is not performed by the placenta? Here, correct option is option C, digestion of food. Question number 18. What connects the fetus to the placenta? Here, correct option is option B, umbilical cord. Question number 19. What is the term of the onset of menstrual in girls? Here, correct option is option C, menarche. Question number 20. Which hormone stimulates milk production after childbirth? Here, correct option is option B, oxytocin. Question number 21. Which hormone is responsible for the development of secondary sexual characteristic in males? Here, correct answer is option C, testosterone. Question number 22. What is the primary function of the ovaries in female? Here, correct option is option B, to produce ova and hormones. Question number 24. What is the function of the prostate gland in males? Here correct option is option D, to secrete fluid and nourish sperm. Question number 25. Which hormone triggered the release of an egg from the ovary? इसका करेक्ट ऑप्शन आप लोग बताइए इन कमेंट सेक्शन में. Number 1 question. Which vitamin is essential for calcium absorption? Here right option is option D, vitamin D. Number 2 question. Which of the following is a sign of hypoglycemia? Here right option is option C, sweating and tremors. Number 3 question. Normal respiratory rate of an adult at rest is? Here right option is option B, 12 to 20 breath per minute. Number 4 question. Which electrolyte is most affected in diarrhea? Here right option is option B, potassium. Number 5 question. What is the normal range of serum sodium? Here right option is option B, 136 to 145 milliequivalent per liter. Number 6 question. A patient with tuberculosis is placed under which type of isolation? Here correct option is option C, airborne. Number 7 question. Which position is best for a patient in shock? Here correct option is option C, Trendelenburg position. Question number 8. Which route has the fastest absorption of drug? Here correct option is option D, intravenous. Number 9 question. Which of the following is used for deep vein thrombosis prevention? Here correct option is option A, warfarin. Question number 10. Bradycardia is defined as a heart rate below. Here correct option is option C, 60 beats per minute. Question number 11. Which hormone maintains pregnancy? Here correct option is option C, progesterone. Question number 12. What is the normal fetal heart rate? Here correct option is option B, 110 to 160 beats per minute. Question number 13. Preeclampsia is characterized by? Here correct option is option B, hypertension and proteinuria. Question number 14. Gravida refers to? Here correct option is option B, number of pregnancies. Question number 15. The best position for uterine fundal height measurement is? Here correct option is option C, supine position. Question number 16. Which sign indicate left-sided heart failure? Here correct option is option C, pulmonary conjugation. Question number 17. What is the antidote for heparin overdose? Here correct option is option B, protamine sulfate. Question number 18. Which condition is treated with insulin? Here correct option is option A, type 1 diabetes. Question number 19. Which organ is affected in hepatitis? It's a very easy question. Right option is option B, liver. Question number 20. What is the cause of angina pectoris? Here correct option is option C, coronary artery blockage. Question number 21. Which lab value indicate renal function? Right option is option B, serum creatinine. Question number 22. Which condition causes moon face and buffalo hump? Here correct option is option C, Cushing syndrome. Question number 23. Which medication is used in asthma attack? Here correct option is option A, salbutamol. Question number 24. What is the normal INR for patient on warfarin therapy? Here correct option is option C, 2.0 to 3.0. Question number 25. Which of the following is symptom of meningitis? Here correct option is option B, neck stiffness. Question number 26. The Glasgow Coma Scale evaluates. Here correct option is option C, neurological status. Question number 27. Which blood group is a universal donor? This is a very easy question. Here right option is option D, O negative. Question number 28. A nurse suspects a patient is having a stroke. What is the priority? Here right option is option D, perform fast assessment. Question number 29. What is the common sign of appendicitis? Here correct option is option B, right lower quadrant pain. Question number 30. Which test confirm tuberculosis? Here correct option is option D, sputum AFB. Number 1 question. Which of the following is the largest organ in the human body? Here right option is option D, skin. Explanation. The skin is the body's largest organ, serving various functions including protection, temperature regulation and sensation. Number 2 question. What is the primary function of red blood cell? Here right option is option B, oxygen transport. Number 3 question. Which of the following hormones is produced by the thyroid gland and regulate metabolism? Here right option is option C, thyroxine T4. Number 4 question. What is the primary function of the alveoli in the lungs? Here right option is option A, oxygen exchange. Question number 5. Which of the following is not a primary tissue type in the human body? Here correct answer is option D, neuronal. Number 6. Which part of the brain is responsible for regulating basic bodily function like breathing and heart rate? Here right answer is answer C, medulla oblongata. Question number 7. What is the main function of the urinary system? Correct option is option C, excretion of waste products. Question number 8. Which hormone is responsible for regulating blood sugar levels in the human body? Correct answer is option A, insulin. Number 9. What part of the digestive system is responsible for absorbing most nutrients from food? Correct option is option B, small intestine. Question number 10. What is the primary function of the lymphatic system? Correct answer is option B, immune defense. Question number 11. Which gland is often referred to as the master gland because it controls many other endocrine glands in the body? Here correct option is option C, pituitary gland. Question number 12. What is the primary function of the spleen in the human body? Here correct answer is option A, blood filtration. Number 13. Which part of the human eye is responsible for bending and focusing light onto the retina? Here correct option is option B, lens. Number 14. What is the primary function of the skeletal system? Here right option is option B, movement. Question number 15. What is the main function of the respiratory system? Here correct answer is option C, gas exchange. Question number 1. Who is known as the father of microbiology? Option A is Louis Pasteur, option B is Anton van Leeuwenhoek, option C is Robert Koch, and option D is Alexander Fleming. Here, correct answer is option B, Anton van Leeuwenhoek. Question number 2, the main method of reproduction in bacteria is option A is binary fission, option B is budding, option C is conjugation, and option D is spore formation. Here, right option is option A, binary fission. Question number 3, which structure help bacteria move? Option A is pili, option B is flagella, option C is cilia, and option D is capsule. Here, right option is option B, flagella. Question number 4, which of the following process kills all microorganisms including spores? Option A is sterilization, option B is disinfection, option C is antisepsis, and option D is pasteurization. Here, correct option is option A, sterilization. Question number 5, the bacterium that causes tuberculosis is option A is Streptococcus pneumonia, option B is Microbacterium tuberculosis, option C is E. coli, and option D is Staphylococcus aureus. Here, correct option is option B, Mycobacterium tuberculosis. Question number 6, bacteria that can survive without oxygen are known as. Here, correct option is option B, anaerobes. Question number 7, the gram strain differentiate bacteria based on. Here, correct option is option C, cell wall composition. Number 8, who discovered penicillin? This is easy question. Here, correct option is option C, Alexander Fleming. Question number 9, the function of the bacteria cell wall is. Here, correct option is B, option B, to protect and give shape. Number 10, the smallest microorganism among the following is. Here, correct option is option C, virus. Number 11, the process where bacteria acquire DNA from their environment is called is. Here, correct option is option A, transformation. Question number 12, eukaryotic microorganisms include. Here, correct option is option C, fungi. Question number 13, an autoclave is used to. Here, correct option is option A, sterilize equipment. Number 14, which bacteria commonly cause food poisoning? Here, right option is E. coli, option D. Number 15, multicellular fungi are known as. Here, correct option is option B, molds. Number 1, the concept of community diagnosis focused on. Here, correct option is option B, assessing community health needs. Question number 2, which is the waterborne disease? Here, correct option is option A, cholera. Question number 3, the role of a health worker in family planning include. Right option is option D, all of above. Question number 4, anemia in pregnant women is commonly caused by. This is a very easy question. Here, right option is option C, iron deficiency. Question number 5, the primary objective of National Rural Health Mission is. Here, right option is option B, reducing infant and maternal mortality rate. Question number 6, which vitamin deficiency causes night blindness? Here, correct option is option A, vitamin A. Question number 7, which of the following is a method of waste disposal in community? Here, right option is option D, all of above. Question number 8, breastfeeding is recommended exclusively for the first. Very easy question. Option C, 6 months. Question number 9, which type of prevention involve immunization? Here, correct option is option A, primary prevention. Question number 10, What is the term for the number of new cases of a disease in a population during a specific time? Here correct option is option B, incidence. Question number 11. The purpose of community health nursing is to. Correct answer is option C, promote and protect the health of the community. Question number 12. Which disease is also known as Hansen's disease? Here correct answer is option A, leprosy. Question number 13. What is the ideal spacing between two pregnancies? Here correct option is option B, 2 years. Question number 14. Which of the following is an indicator of malnutrition? Here correct option is option D, all of above. Question number 15. The leading cause of neonatal mortality is. Here correct option is option A, preterm birth complication. Hey everyone, I am Mahi and welcome my YouTube channel. তো আমি আপনাদেরকে একটা কথা বলতে চাই। প্রথমেই এটা কথা আমি বলে দিচ্ছি যে আমার কোশ্চেনগুলো আগে থেকেই ঠিক করানো আছে, ঠিক আছে? এটা শুধু আমি রিভিশন পারপাসের জন্য ভিডিও করছি, প্র্যাকটিসের জন্য না। প্র্যাকটিসের জন্য ভিডিও আমি সন্ধ্যাবেলায় না হলে কালকে সকালে আমি আপলোড করে দিব, এডিট কমপ্লিট হলেই আপলোড করে দিব। এটা শুধু রিভিশন পারপাসের জন্য। তো চলো কোশ্চেন নাম্বার 1 থেকে আমরা স্টার্ট করি। কোশ্চেন নাম্বার 1. হোয়াট ইজ দ্য মেইন ফাংশন অফ দ্য হিউম্যান হার্ট? Here, right option is option B, to pump blood throughout the body. Question number 2. Which organ is responsible for the exchange of gases in the human body? Here, right option is option B, lungs. Question number 3. Which internal organ control the overall coordination and communication of the body? Here, right option is option B, brain. Question number 4. Which part of the digestive system is mainly responsible for nutrient absorption? Here, right option is option C, small intestine. Question number 5. Which organ remove waste product and excess water from the blood? Here, right option is option C, kidney. Question number 6. Which internal organ store bile produced by the liver? Here, correct option is option A, gallbladder. Question number 7. Which part of the brain control balance and coordination? Here, correct option is option B, cerebellum. Question number 8. Which organ is known as the chemical factory of the body? Here, correct option is option A, liver. Question number 9. Which gland regulate metabolism in the human body? Here, correct option is option A, thyroid gland. Question number 10. Which organ helps in detoxifying harmful substances from the blood? Here, correct option is option B, liver. Question number 11. Which part of the respiratory system carries air to the lungs? Here, correct option is option A, trachea. Question number 12. Which internal organ secrete insulin to regulate blood sugar? Here, correct option is option B, pancreas. Question number 13. Which part of the nervous system control involuntary action? Here, correct option is option B, autonomic nervous system. Question number 14. Which organ filter old and damaged red blood cell? Here, correct option is option B, spleen. Question number 15. Which organ is located in the thoracic cavity and surrounded by ribs? It is a very easy question. Here, right option is option B, heart. Question number 16. Which organ absorb most of the water from undigested food? Here, correct option is option B, large intestine. Question number 17. Which part of the brain control breathing and heartbeat? Here, correct option is option B, medulla oblongata. Question number 18. Which internal organ produce digestive enzyme and hormones? Here, correct option is option B, pancreas. Question number 19. Which system is responsible for transporting oxygen and nutrients? Here, correct option is option B, circulatory system. Question number 20. Which organ acts as a barrier and first line of defense for the body? Here, correct option is option A, skin. Question number 21. Which organ produces bile to help in fat digestion? Here, correct option is option A, liver. Question number 22. Which internal organ helps in maintaining the body's water balance? Here, correct option is option B, kidney. Number 23. Which part of the brain is responsible for thinking and reasoning? Here, correct option is option A, cerebrum. Question number 24. Which organ stores glycogen for energy? Here, correct option is option B, liver. Question number 25. Which part of the digestive system breaks down proteins using gastric juice? Here, correct option is option B, stomach. Question number 26. Which internal organ helps in the production of red blood cell? Here, correct option is option A, bone marrow. Question number 27. Which gland is called the master gland of the body? Here, correct option is option A, pituitary gland. Question number 28. Which organ plays a key role in blood clotting by storing platelets? Here, correct option is option B, spleen. Question number 29. Which part of the respiratory system helps in sound production? Here, correct option is option B, larynx. Question number 30. Which internal organ converts ammonia into urea? Here, correct option is option B, liver. Question number 31. Which gland regulates the body's sleep cycle by releasing melatonin? Here, correct option is option C, pineal gland. Question number 32. Which organ forms urine by filtering blood? Here, correct option is option A, kidney. Question number 33. Which part of the digestive system connects the throat to the stomach? Here, correct option is option B, esophagus. Number 34. Which part of the brain maintains body temperature and hunger? Here, correct option is option A, hypothalamus. Number 35. Which internal organ is responsible for producing antibodies? Here, correct option is option A, spleen. Number 36. Which part of the circulatory system carries oxygenated blood from lungs to heart? Here, correct option is option B, pulmonary vein. Question number 37. Which organ produces digestive juice that emulsifies fat? Here, correct option is option A, liver. Question number 38. Which organ removes carbon dioxide from the blood? Here, correct option is option B, lungs. Number 39. Which organ temporarily stores urine before excretion? It's a very easy question. Here, right option is option number C, urinary bladder. Number 40. Which gland produces adrenaline hormone during stress? Here, correct option is option B, adrenal gland. Question number 41. Which organ helps regulate blood sugar by releasing glucagon? Here, correct option is option C, pancreas. Question number 42. Which part of the brain connects the brain with the spinal cord? Here, correct option is option B, medulla oblongata. Number 43. Which internal organ is most responsible for filtering toxin from the blood? Here, correct option is option A, liver. Number 44. Which organ contains the alveoli where the gas exchange occurs? Here, correct option is option C, lungs. Number 45. Which gland regulates calcium level in the blood? Here correct option is option B, parathyroid gland. Question number 46. Which part of the digestive system reabsorb water and form feces? Here correct option is option B, large intestine. Number 47. Which internal organ help in breaking down old hemoglobin? Here correct option is option D, spleen. Question number 48. Which organ act as pump in the circulatory system? Here correct option is option C, heart. Question number 49. Which gland release growth hormone in the human body? Here correct option is option A, pituitary gland. Question number 50. Which organ produce digestive enzymes such as amylase and lipase? Here correct option is option B, pancreas. তো এখানে আমি আমাদের হিউম্যানের যে বডির ভিতর থেকে যতগুলো আমাদের প্রবলেম আসতে পারে, এমসিকিউজ আসতে পারে, এখানে আমি কমপ্লিট করেছি। নেক্সট আমি বলবো যে হিউম্যান রিপ্রোডাক্টিভ সিস্টেম ফিমেলসের, ঠিক আছে। এরপরে আবার কোয়েশ্চেন নাম্বার 1 থেকে স্টার্ট করব ফিমেল রিপ্রোডাক্টিভ সিস্টেমের এমসিকিউজ। তো স্টার্ট করলাম আমি ফিমেল রিপ্রোডাক্টিভ সিস্টেমের এমসিকিউজ। কোয়েশ্চেন নাম্বার 1. Which hormone trigger ovulation in the menstrual cycle? Here correct option is option B, LH, luteinizing hormone. Question number 2. Which pelvis type is most favorable for vaginal delivery? Here correct option is option B, gynecoid. Question number 3. What is the normal duration of puerperium? Here correct option is option C, 6 weeks. Question number 4. Which hormone maintain pregnancy after implantation? Here correct option is option C, progesterone. Question number 5. Which part of placenta is maternal in origin? Here right option is option B, decidua bacillis. Question number 6. Which fetal presentation is most common? Here correct option is option B, cephalic presentation. Number 7. Which condition is termed as pregnancy induced hypertension? Here correct option is option B, BP less than equal to 140/90 mm of Hg. Question number 8. Which test confirm rupture of membranes? Here correct option is option A, nitrozyme test. Number 9. Which is the most common cause of maternal mortality worldwide? Here correct option is option B, hemorrhage. Question number 10. Which is the best method to diagnose ectopic pregnancy? Here correct option is option A, ultrasound. Question number 11. Which vitamin prevents neural tube defect? This is a very easy question. Here right option is option B, folic acid. Number 12. What is the usual time for quickening in primigravida? Here correct option is option number C, 20 weeks. Number 13. Which hormone causes relaxation of pelvic ligaments? Here correct option is option B, relaxin. Number 14. Which drug is used for prevention of postpartum hemorrhage? Here correct option is option B, oxytocin. Number 14. Which condition is also called toxemia of pregnancy? Here correct option is option A, preeclampsia. Number 16. Which fetal heart sound rate is normal? Here correct option is option C, 120 to 160 beats per minute. Question number 17. Which method is best for emergency contraception within 72 hours? Here correct option is option A, IUCD. Question number 18. Which is the safest period for surgical termination of pregnancy? Here correct option is option A, first trimester. Number 19. What is the most common site of ectopic pregnancy? Here correct option is option C, fallopian tube. Number 20. Which instrument is used to measure pelvic diameters? Here correct option is option A, pelvimeter. Number 21. Which hormone stimulates milk secretion? Here correct option is option B, prolactin. Question number 22. Which hormone helps milk ejection reflex? Here correct option is option B, oxytocin. Here, question number 23. Which type of twin result from fertilization of two ova? Here correct option is option C, dizygotic. Number 24. Which is the earliest sign of pregnancy? Here correct option is option A, amenorrhea. Question number 25. Which is the most common complication of prolonged labor? Here correct option is option C, postpartum hemorrhage. Number 26. Which hormone is measured in pregnancy tests? Here correct option is option C, HCG hormone. Question number 27. Which sign indicate imminent eclampsia? Here correct option is option C, epigastric pain. Question number 28. Which is the preferred incision for caesarean section? Here correct option is option B, transverse. Number 29. Which is the gold standard investigation for infertility? Here correct option is option B, laparoscopy. Question number 30. Which maneuver is used in shoulder dystocia? Here correct option is option A, MC Robert. Number 31. Which vaccine is contraindicated in pregnancy? Here correct option is option C, rubella. 1. Which vitamin is essential for blood clotting? Here correct option is option D, vitamin K. Question number 2. The normal range of hemoglobin in? Here correct option is option B, 12 to 16 gram per deciliter. Question number 3. What is the primary function of red blood cell? Here correct option is option B, carry oxygen. Question number 4. Which type of insulin has the fastest onset of action? Here correct option is option A, regular insulin. Question number 5. What is the normal respiratory rate in adults? Here correct option is option B, 12 to 20 breaths per minute. Question number 6. Which electrolyte imbalance causes tetany? Here correct option is option B, hypocalcemia. Question number 6. Which pulse site is most commonly used to check an unconscious patient pulse? Here correct option is option C, carotid pulse. Question number 8. Which condition is characterized by an abnormal increase in white blood cell? Here correct option is option B, leukocytosis. Question number 9. What is the normal pH range of blood? Here correct option is option C, 7.35 to 7.45. Question number 10. Which is the most common site for intramuscular injection in adults? Here correct option is option C, ventrogluteal muscle. Ventrogluteal muscle is common site for injection or deltoid muscle এও দেওয়া যায় কিন্তু common site is ventrogluteal muscles. Question number 11. Which type of precaution is required for a patient with tuberculosis? Here correct option is option C, airborne. Question number 12. Which is the first line treatment for anaphylaxis? Here correct option is option C, epinephrine. Question number 13. Which cranial nerve is responsible for vision? Here correct option is option B, optic. Question number 14. Which organ produces insulin? Here correct option is option B, pancreas. Question number 15. Which electrolyte is most abundant in the extracellular fluid? Here, correct option is option A, sodium. Question number 16. Which condition result from a deficiency of ADH, that means antidiuretic hormone? Here, correct option is option B, diabetes insipidus. Question number 17. Which position is best for a patient experiencing shock? Here, correct option is option B, Trendelenburg position. Question number 18. Which hormone regulates calcium level in the blood? Here, correct option is option B, parathyroid hormone. Question number 19. What is the primary function of platelets? Here, correct option is option number C, blood clotting. Question number 20. Which part of the brain control respiration? Here, correct option is option B, medulla oblongata. Question number 21. Which artery is commonly used to measure blood pressure? Here, correct option is option B, brachial artery. Question number 22. Which of the following is a common symptom of hypoglycemia? Here, correct option is option B, shakiness. Question number 23. Which organ is primarily responsible for detoxification in the body? Here, correct option is option A, liver. Question number 24. What is the normal heart rate range for an adult? Here, correct option is option B, 60 to 100 beats per minute. Question number 25. Which infection is commonly associated with prolonged use of antibiotics? Here, correct option is option B, Clostridium difficile. Question number 26. Which organ store and concentrate bile? Here, correct option is option B, gallbladder. Question number 27. What is the primary mode of transmission for hepatitis B? Here, correct option is option C, blood-borne. Question number 28. Which blood vessel carries oxygenated blood from the lungs to the heart? Here, correct option is option A, pulmonary vein. Question number 29. Which term refers to difficulty in swallowing? Here, correct option is option B, dysphagia. Question number 30. Which condition is commonly associated with night sweat, weight loss and persistent cough? Here, correct option is option A, tuberculosis. Question number 31. Which of the following is a late sign of hypoxia? Here, correct option is option B, cyanosis. Question number 32. What is the antidote for opioid overdose? Here, correct option is option A, naloxone. Question number 33. Which part of the heart receives deoxygenated blood from the body? Here, right option is option C, right atrium. Question number 34. Which condition is caused by deficiency of vitamin B12? Here, correct option is option B, Pernicious anemia. Question number 35. What is the most common site for checking an infant's pulse? Here, correct option is option B, brachial artery. Question number 36. Which part of the brain is responsible for maintaining balance and coordination? Here, correct option is option B, cerebellum. Question number 37. Which of the following is a sign of increased intracranial pressure? Here, correct option is all of above. That means bradycardia, hypertension and irregular respiration. Question number 38. Which of the following is an isotonic IV fluid? Here, correct option is option B, 0.9% of NaCl. Question number 39. Which vitamin help in calcium absorption? Here correct option is option B, vitamin D. Question number 40. Which type of a fracture is most common in children? Here correct option is option A, green stick fracture. Question number 41. Which condition is associated with increased uric acid levels? Here correct option is option B, gout. Question number 42. Which of the following best describe third degree burns? Here correct option is option C, damage to all skin layers. Question number 43. Which electrolyte is primarily responsible for maintaining fluid balance in the body? Here correct option is option B, sodium. Question number 44. What is the primary function of the spleen? Here correct option is option B, blood filtration. Question number 45. Which of the following medication is a loop diuretic? Here correct option is option A, furosemide. Question number 46. Which of the following is a common cause of pulmonary embolism? Here correct option is option A, deep vein thrombosis. Question number 47. Which part of the nephron is responsible for filtering blood? Here correct option is option B, glomerulus. Question number 48. Which condition is associated with excessive ADH secretion? Here correct option is option B, SIADH. That means syndrome of inappropriate ADH. Question number 49. Which medication is used to treat bradycardia? Here correct option is option A, atropine. Question number 50. Which of the following is the best position for a patient in respiratory distress? Here correct option is option B, high followers position. Hey everyone, welcome my YouTube channel. তো এবার থেকে সিবিটি এক্সাম কন্ডাক্ট করে দেওয়া হলো। এখন আমাদেরকে এমসিকিউ খুব বেশি করে প্র্যাকটিস করতে হবে যাতে আমাদের পরীক্ষাটা ভালো হয়। অ্যান্ড যারা এর আগে সিবিটি পরীক্ষা দাওনি তারা অন্তত একবার প্র্যাকটিস করে যাও। অল দ্য বেস্ট। অ্যান্ড সিবিটি এক্সামের জন্য কী কী সিলেবাস আসবে আমি আপনাদেরকে ফার্দার ভিডিওতে ডিটেলসে বলে দেবো। তবে সিএইচও পরীক্ষাতে যেসব সিলেবাস দেওয়া হয়েছে এর আগে সেসব আমরা পড়ে পরীক্ষাটা ইজিলি মানে ক্র্যাক করতে পারি। ওকে গাইজ, বাই বাই। देन नेक्स्ट वीडियो पे हम देखा करছি। हेलो एवरीवन, तो चलो पीडियाट्रिक का कुछ क्वेश्चन हम लोग डिस्कस कर लेते हैं जो वेरी इंपॉर्टेंट है एंड बेसिक क्वेश्चन है। आप लोगों को हर इंटरव्यू में ये क्वेश्चन पूछा जाता ही है, ठीक है। तो नंबर 1 क्वेश्चन, लेंथ ऑफ न्यू बॉर्न। जब कोई बेबी बर्थ होता है न्यू बॉर्न का मतलब 0 से 1 मंथ का बीच में, ठीक है, तो उसका लेंथ कितना होता है, हाइट कितना होता है? 45 से 55 सेंटीमीटर, याद रखना है। न्यू बॉर्न का हाइट मतलब लेंथ। नंबर 2 क्वेश्चन, हीमोग्लोबिन लेवल इन न्यू बॉर्न, ठीक है। और जब बेबी तो बर्थ होता है 0 से 1 मंथ का बीच में उसका हीमोग्लोबिन का लेवल कितना होता है? इज़ वेरी इंपॉर्टेंट, 18 ग्राम, ठीक है, 18 ग्राम्स। नंबर 3 क्वेश्चन, फर्स्ट स्टूल ऑफ न्यू बॉर्न का फर्स्ट स्टूल उसको क्या बोलते हैं? म्यूकोनियम, ठीक है। नंबर 4 क्वेश्चन, न्यूबॉर्न बॉडी टेम्परेचर। न्यूबॉर्न का बॉडी टेम्परेचर कितना होता है? 36.5 टू 37.5 डिग्री सेंटीग्रेड, ठीक है, न्यूबॉर्न का टेम्परेचर होता है बॉडी का। नॉर्मल हेड सर्कमफेरेंस कितना होता है? जो हेड होता है उसका सर्कमफेरेंस कितना होता है नॉर्मली? 35 सेंटीमीटर, ठीक है, ये नॉर्मल हेड सर्कमफेरेंस है। और 6 नंबर आ जाता है, नॉर्मल हार्ट रेट कितना होता है? नॉर्मल हार्ट रेट जो न्यूबॉर्न का होता है ना बहुत ही ज़्यादा होता है, जैसे 120 से 160 बीट्स होता है पर मिनट, ठीक है, 1 मिनट में 120 से 160 बीट्स होता है पर मिनट, ठीक है। न्यूबॉर्न का ये नॉर्मल हार्ट रेट है। अब कुछ एब्रीविएशंस के बारे में डिस्कस कर लेते हैं। फुल फॉर्म जो बहुत इंपॉर्टेंट है, कॉम्पिटिटिव एग्जाम में पूछता है फुल फॉर्म जो मेडिकल से रिलेटेड है, ठीक है। तो आ जाइए, CAD इसका फुल फॉर्म होता है कोरोनरी आर्टरी डिजीज़, ठीक है। नंबर 2 HIV, HIV का फुल फॉर्म है ह्यूमन इम्यूनो डेफिशिएंसी वायरस, ठीक है। और एक होता है एड्स, AIDS, तो उसका होता है एक्वायर्ड इम्यूनो डेफिशिएंसी सिंड्रोम। देन HTN का फुल फॉर्म है हाइपरटेंशन, ठीक है। देन PE का फुल फॉर्म है पल्मोनरी इम्बोलिज्म, ठीक है। देन नेक्स्ट है COPD का फुल फॉर्म है क्रॉनिक ऑब्स्ट्रक्टिव पल्मोनरी डिजीज, ठीक है। देन नेक्स्ट आ जाता है DM का फुल फॉर्म है डायबिटीज मेलाइटस, ठीक है। देन नेक्स्ट आ जाएगा CH का फुल फॉर्म है क्रॉनिक हार्ट फेलियर, ठीक है। देन नेक्स्ट आ जाएगा IBD का फुल फॉर्म है इन्फ्लामेटरी ब्लड डिजीज या फिर डिसऑर्डर, ठीक है। ये हो गया कुछ एब्रिवेशंस जो एग्जाम में पूछा जाता ही है, ठीक है, जो मेडिकल से रिलेटेड है, हॉस्पिटल वार्ड से रिलेटेड है। ओके गाइस, बाय बाय, मिलते हैं फिर नेक्स्ट वीडियो में। क्वेश्चन नंबर 31, एट व्हाट एज डू बेबीज स्टार्ट teething usually? Here right option is option B, 4 to 7 months. Question number 32, which vaccine is given at birth? Here right option is option D, BCG vaccine, full form Bacillus calmette-guerin. Question number 33, Coplic spot are seen in. Here right option is option A, measles. Question number 34, the head circumference of a newborn is approximately. Here right option is option C, 35 centimeter. Question number 35, which condition causes blue baby syndrome? Here right option is option A, teratology of Fallot. Question number 36, schizophrenia is best defined as. Here right option is option C, thought disorder. Question number 37, lithium is primarily used by. Here right option is option B, bipolar disorder. Question number 38, what is the therapeutic range of lithium? Here correct option is option B, 0.5 to 1.5 milliequivalent per liter. Question number 39, which of the following is a positive symptom of schizophrenia? Here correct option is option B, hallucinations. Question number 40, what is the priority action for the suicidal of patient? Here right option is option B, remove harmful objects. Question number 41, which color bag is used for infectious waste in hospital? Here correct option is option A, yellow. Question number 42, which of the following is the primary level of prevention? Here correct option is option A, immunization. Question number 43, the minimum gap between two doses of oral polio vaccine is. Here correct option is option D, 28 days. Question number 44, the first choice for safe drinking water treatment at home is. Here right option is option A, boiling. Question number 45, which of the following is a vector for malaria? Here correct option is option C, anaphylaxis. Question number 46, which site is best for IM injection in adult? Here correct option is option B, gluteus medius. Question number 47, what is the normal pH of urine? Here correct option is option B, 5.0 to 6.5. Question number 48, which is the most accurate method for measuring body temperature? Here correct option is option C, rectal. Question number 49, which bed position is used for a patient with breathing difficulty? Here correct option is option B, followers position. Question number 50, hand hygiene prevention which type of infection? Here correct option is option B, nosocomial. Question number 51. Digoxin is used to treat. Here correct option is option B, heart failure. Question number 52. Which drug is used to treat anaphylaxis? Here correct option is option A, adrenaline. Question number 53. The antidote for morphine overdose is. Here correct option is option C, flumazenil. Question number 54. Which drug class does furosemide belong to? Furosemide meaning Lasix injection. Here correct option is option B, diuretic. Question number 55. তোমরা কমেন্ট বক্সে সঠিক অ্যান্সারটি ঠিক করো। আমি কোশ্চেনটা বলে দিচ্ছি। দ্য সাইড ইফেক্ট অফ অ্যামিনোগ্লাইকোসাইডস ইজ। কারেক্ট অ্যান্সারটি তোমরা বলে দাও ইন কমেন্ট বক্স। কোশ্চেন নাম্বার 56. Which insulin is rapid acting? Here correct option is option C, Lispro. Question number 57. Which drug is used to reverse benzodiazepine overdose? Here correct option is option B, flumazenil. Question number 58. Which route bypass first pass metabolism? Here correct option is option B, sublingual. Question number 59. A medication order leads IV push state. What does state means? Here correct option is option B, immediately. Last question. Question number 60. Which vitamin enhance iron absorption? Here correct option is option C, vitamin C. Point to be noted. Which vitamin enhance iron absorption? Here correct option is vitamin C. If asked question which vitamin enhance calcium absorption, then correct option is vitamin D. Question number 1. Which nutrient helps in tissue repair? Here correct option is option B, protein. The pacemaker of the heart is characterized by. Here right option is option D, SA node, that means cyanoatrial node. Question number 3. Universal safety precautions are a set of guidelines to protect the. Here correct option is option A, healthcare workers. Question number 4. Growth hormone will be secreted by which of the following endocrine glands? Here correct option is option B, pituitary gland. Question number 5. Breakdown of glycogen to glucose is known as. Here correct option is option C, glycogenolysis. Question number 6. Inadequate pumping action of heart is known as. Here correct option is option D, cardiogenic shock. Question number 7. What is the average weight gain of the neonate per day? Here correct option is option C, 25 to 30 grams. Question number 8. What does a mixture of surfactant contain? Here correct option is option A, protein and lipid. Question number 9. Which is the hormone that increases water reabsorption by increasing a water channel or aquaporins? Here correct option is option C, anti-diuretic hormone. Question number 10. Which of the following symptoms should be watched for a patient receiving a loop diuretic? Here correct option is option B, weak irregular pulse. Question number 11. Which one is the second line drug of tuberculosis? Here correct option is option C, amikacin. Number 12. What is the other term of recovery from an illness? इसका करेक्ट आंसर आप लोग कमेंट बॉक्स में ज़रूर लिखें। क्वेश्चन नंबर 13. द रिमूवल ऑफ टिश्यू फ्रॉम द प्लूरल स्पेस इज नोन एज. Here correct option is option D, pleural biopsy. Number 14. The final step of the purification of water on a large scale is. Here correct option is option D, disinfection. Question number 15. What is the symbol of the element of tungsten? Here correct option is option D, W. Question number 16. Which of the following is a heart-shaped pelvis? Here correct option is option D, android. Question number 17. The time interval between infection of a suspected person and the appearance of signs and symptoms of the disease is called. Here right option is option C, incubation period. Question number 18. Which is described as the powerhouse of cell? Very easy question. Here right option is option C, mitochondria. Question number 19. Prions include. Here correct option is option D, proteins. Question number 20. Who is recognized as the father of psychoanalysis? Here correct option is option D, Sigmund Freud. Question number 21. Which cranial nerve is responsible for the sense of smell? Here correct option is option B, olfactory. Number 22. Near sightedness is also known as. Here correct option is option A, myopia. Question number 23. Oxidation among the following is. Correct option is option D, gain of oxygen. The most common type of stone that occur in nephrolithiasis is. Here correct option is option B, calcium stone. Question number 25. The first menstrual flow begins at puberty and is termed as. Here correct option is option A, menarche. चलो गाइज फटाफट से कुछ क्वेश्चन रिवाइज कर लेते हैं. ऑलरेडी टिक किया हुआ है क्वेश्चंस में. दिस क्वेश्चंस आर ओनली फॉर रिवीजन पर्पस, सो प्लीज़ डोंट माइंड. चलो रिवीजन स्टार्ट करते हैं. यहाँ पे बोल रहे हैं व्हाट इज़ द मेन फंक्शन ऑफ स्केलेटल मसल इन द ह्यूमन बॉडी. तो ऑप्शन ए इज़ करेक्ट है, टू जनरेट वॉलेंटरी मूवमेंट्स. Question number 2. Which type of muscle is controlled involuntarily by the autonomic nervous system? Here correct option is option B, smooth muscle. Question number 3. Where is smooth muscle commonly found? Here correct option is option B, in the walls of internal organs. Question number 4. Why does cardiac muscle not fatigue easily? Here correct option is option C, because it has numerous mitochondria. Question number 5. What gives skeletal muscles their striated appearance? Here correct option is option A, overlapping actin and myosin filaments. Question number 6. Which structure connects muscle to bones? Here correct option is option B, tendons. Question number 7. What is the functional unit of a muscle fiber called? Correct option is option B, sarcomere. Question number 8. Which ion is essential for muscle contraction? Correct option is option B, calcium. Question number 9. What is released from the sarcoplasmic reticulum during muscle contraction? Correct option is option A, calcium ions. Question number 10. Which energy molecule is directly required for muscle contraction? Here option B is correct, ATP. Question number 11. Why does rigor mortis occur after death? Here correct option is option B, because ATP is no longer available. Question number 12. What is the name of the connective tissue covering a whole muscles? Here right option is option C, epimysium. Question number 13. Which type of muscles show rhythmic contraction without consequence control? Here correct option is option C, cardiac muscles. Question number 14. Where does muscle contraction begin within the muscle fiber? Here right option is option B, sarcomere. Question number 15. What is the role of anticholining in muscle contraction? Here correct option is option C. It transmits nerve impulses across the neuromuscular junction. Question number 16. Which protein directly bind to calcium during muscle contraction? Here correct option is option C. Troponin. Question number 17. Why do muscle need oxygen during prolonged activity? Here correct option is option B. To produce ATP through aerobic respiration. Question number 18. What happens when lactic acid accumulates in muscles? Here right option is option B. Muscle fatigue occurs. Question number 19. Which part of the neuron stimulates muscle contraction? Here correct option is option B. axon terminal. Question number 20. What is the junction between a motor neuron and muscle fiber called? Correct option is option B. Neuromuscular junction. Question number 21. What term describe the ability of a muscle to shorten and produce force? Correct option is option C. Contractility. Question number 22. Which type of muscle tissue has intercalated disc? Right option is option C. Cardiac muscles. Question number 23. Why does ATP production primarily occur within muscle cell? Here correct option is option B. Mitochondria. Question number 24. Why are slow twitch muscle fiber more resistant to fatigue? Here correct option is option C. They have high oxygen supply and more mitochondria. Question number 25. What structure transmit action potential deep into the muscle fiber? Here correct option is option B. T-tubules. Question number 26. Which part of the sarcomere moves closer together during contraction? Here correct option is option A. Z lines. Question number 27. What happened to the H zone during muscle contraction? Correct option is option A. It disappears. Question number 28. Which enzyme break down acetylcholine after nerve stimulation? Here correct option is acetylcholinesterase. Question number 29. What is the role of myoglobin in muscle cells? Here correct option is option B. Binding oxygen. Question number 30. Where are multi-unit smooth muscles found? Correct option is option B. In the large arteries and iris of the eye. Okay guys, thanks for watching. Bye bye. मिलते हैं नेक्स्ट वीडियो में.